Hey, Doc audience, a prophet once said to me, show me a person that doesn't want to look better, and I'll show you a person with no pulse, which is such a true statement because everybody wants to look their best at all the times. But sometimes those solutions are a little bit invasive for some people, and they're looking for maybe the easier way out. But what if you could get a facelift without surgery, the so-called liquid facelift? And that's our topic for today. We're going to dissect liquid facelift and tell you exactly what you need to know.
What a great topic. I hear it all the time from my patients and on Instagram. But what is a real liquid facelift? Well, hey, doc, you know what? We're going to tell you exactly what it is. And at the end, we'll tell you what's real and what's not. Because a liquid facelift is neither liquid nor is it a facelift. You know, it's a filler, which is a gel, and it's not a facelift. It's like a liquid rhinoplasty. That's a filler to the nose. This is filler to the face. It's not a facelift. It's not surgery, Bill. As you know, we're plastic surgeons, but it helps in a small group of patients that really aren't ready for a facelift. Because if you put so much filler in somebody's face that's truly aging, where they've lost a lot of fat in their face and they have sagging, you know, they'll look like a Stay Puft marshmallow.
Yeah. And Rod, you know, we always talk about the lighthearted and hardcore realities of plastic surgery and beyond. This is not necessarily a hardcore reality, but it is a reality that lots of people want the easy way out. And when they hear about surgery, a lot of people don't want to have surgery and they're scared of the pain and the recovery and the expense and whatever. But the thing is that if you need a surgical facelift and somebody convinces you that you can do this liquid facelift with fillers or other things, you're going to not get the result that you want.
100%. And you know, it's statistically been shown that 85% of people want something to look better, but only 10-15% really want to have surgery.
Who are the subset of people that could consider doing more, whether it's filler or it's some sort of lasers or non-surgical things? Tell us who the people that do the best with that type of modality.
I think the people that do the best are those people that don't really need a facelift yet. They have no signs of true jowling, like I've got a little jowling or facial fat loss. They really don't need much. And if you don't need much, you can do fillers to fill out those fat areas where you've lost fat, where you lose it around your eyes and around your cheeks and a little bit in your lips, as long as you don't overdo it. But the moment you start having significant jowls, forget the fillers, because if you chase the jowls with fillers, you'll end up looking very weird.
Yeah. Well, Rod, you're a renowned facial rejuvenation expert. What's the craziest thing somebody that's coming to see you that's had too much filler, and how did you deal with that?
Well, I recently saw a patient from Las Vegas who actually used to live in LA, and she had so much filler in her face that I'm actually starting a stage process of removing the filler.
How do you do that?
Gradually with hyaluronidase, but you can't remove it all. So I've done 4 stages of of removal with hyaluronidase. And then recently I also did a modified lift to actually remove some of the deeper filler.
Luckily, we don't see it as much. Especially we go to the plastic surgery meetings all around the world. Sometimes you'll see these people like they're. I remember one time I was there with my wife, and she's like, "What is going on with so and so's wife?" I'm like, "I don't know. It's just too much filler, too much surgery. There's a balance there that you need to strike to get beauty, and too much of anything is never good."
Well, I totally agree. I mean, and there's famous people like Kenny Rogers, who's amazingly great, singer, and then his facial rejuvenation did not serve him well, and so, I think you have to balance, the natural look versus that complete overdone windswept look, which is not, most people don't like that.
And Rod, what's the Hey Doc full throttle tip of the day for liquid facelift?
The tip of the day for liquid facelift: it's not liquid, it's not a facelift. It's good for a younger patient that hardly has any type of skin atrophy or actually aging, but has loss of fat in their face. Modest amount, fillers work good, but add Botox. It always makes it look more natural. And if you're really going to have a true facelift, see a board certified plastic surgeon or a facial plastic surgeon that's an expert in the science of aging. Somebody that does this all the time. Look at their website, look at their credentials. Do they operate, in an accredited facility, use an anesthesiologist or a CRNA? Just be safe.
The truth will set you free.
That's right. The truth will set you free.
Not only that, truth will set your plastic surgery spirit free.
That's exactly right.
Well, it's a great topic, Rod. And if you like this, you're not going to want to miss the video on thread lifts.